All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. Today we are going to talk about a letter, a small study, but that is interesting actually. It is about the masks and if the cloth masks cause hypoxia. This has been a lot of discussion where people say that if we wear masks that cause carbon dioxide to be trapped in here, which in turn causes hypoxia or reduction in oxygen saturation. So I saw this study and I thought it was interesting to discuss it with the cool beans as well. So we're going to start looking at that. Welcome to everyone. And here is that study. This is drbeen.com. This is that study. The URL is in the description as well. The study is October 30th. It is actually a research letter. It's a small study. Peripheral oxygen saturation in older persons wearing non-medical face masks in community settings. So that is the basic idea here. So before we get into it, I want to show you a few things. Number one, a few updates about the cool beans I've been talking about. So there is one cool bean who is about 58 years old or young. He had the COVID-19 positive, and now with the grace of God, with the lucky stars, whoever you believe in or do not believe in anyone, he has, I feel, recovered. So that is a great news. He had been on prophylaxis with the things that I had been discussing. Now, during the illness, he started ivermectin as well, and he has recovered very well. The other cool bean from Greece, who is a doctor as well, he is recovered as well. And now he's still chasing where are his B cells because he's not able to see his antibodies. So I'm hoping that he would do some more testing and figure that out. And finally, one more person who was not a cool bean. However, somebody who is a cool bean reached out to me. She's a doctor. She said that she has a colleague whose father, so her colleague is a doctor as well. Her colleague's father is COVID-19 positive, and he is deteriorating fast, and she asked them to talk with me. So the situation is that when we started talking about 3 days ago, the person's age is 70 years old, male. He has ischemic heart disease. He has diabetes as well. Cannot do prone positioning because of some of the body issues. Was on dexamethasone plus some more remdesivir as well, and was not improving and was deteriorating. The oxygen saturation was dropping occasionally below 90 and then would come back up. They had oxygen at 2 liter giving to him, but whenever he'll get up from his bed and go to the restroom and come back, his oxygen would drop. One side of the chest had developed creps or crepitations, the sounds in there, and those crepitations were increasing. The C-reactive protein was increasing, serum ferritin was increasing, liver enzymes were increasing. That means liver damage was occurring. Renal enzymes were increasing as well. Renal profile was deteriorating, or creatinine was increasing. So all those metrics, all those values were showing a deterioration. Credit to them that when I called them, they had already given 1 dose of ivermectin, and they thought that that was sufficient. I started them on ivermectin daily, BD 6 milligram, 6 milligram in the morning, 6 milligram in the evening. With that, I started the vitamin D, vitamin C, and you know my general regime. So I started that, and today his breathing oxygen saturation is 97 without oxygen. So that is a great news. He is still not fully recovered. He still have crepitations in his lungs, but he was on these medications like dexamethasone and remdesivir for 1 week. And now just 2 or 3 days ivermectin addition plus vitamin D's addition and zinc and quercetin and all those extra things that I do. He has started recovering while earlier he was going down. And now he has started recovering and his oxygen saturation is coming up and he is able to sleep well as well. So that is another very good news that I have. I'm praying that he fully recovers. He's not out of the woods. He still is unstable, but hopefully he would come out. So with this, let's start our discussion. So that is a cool bean update. The discussion is the cloth masks do not cause hypoxia. So this is the link here. This is the letter. So in this letter, what they have done is this is actually done in, somehow this is not refreshing. So I'm going to change it. Anyways, let's go back to my picture here. Somehow that PDF is not refreshing. So here is what's happening. So this is an Ontario-based study. The study was done in a retirement community. What they wanted to check was if the usage of the standard masks, the cloth masks, will actually cause hypoxia. So the hypothesis was that wearing a mask will change oxygen saturation. Method, what they did was they started a group of folks. They recruited a group of folks who were all of them greater than 65 years of age. They all had at least one comorbidity, for example, hypertension or diabetes, etc. They excluded those folks who could develop hypoxia at rest as well, for example, cardiac disease patients. And if they would develop hypoxia at rest, then you do not know it occurred because of the mask or it occurred by itself. They also excluded anyone who was not able to take their own mask off in case mask did something. Because remember, they're starting with a hypothesis, and this could be that it was proven that the masks actually cause an issue, or it could be that the masks do not cause an issue. So right in the beginning, they could not do this, that they would recruit someone who could not remove the mask if the mask started causing an issue. Now remember this, that while you're looking at the study, this is a very legitimate thing that sometimes when people wear masks, they have a complaint that I cannot breathe. That is mostly claustrophobia. And what happens is that when we, even medical doctors, in the beginning, when we start using masks, there is a level of anxiety with using mask, and claustrophobia is there, and it feels the air starts accumulating and the mask becomes a little soggy, or it seems different. And that causes anxiety. But slowly we become used to it and it becomes okay. The question here is more scientific, that would the mask actually cause oxygen saturation to drop? So what they did was they had 25 participants who were all greater than 65 years of age. This was between July and August 10th. They gave them the oximeters and asked them to measure their oxygen levels with mask and without mask. And what they did was they asked them to first measure their oxygen an hour before using the mask. And they asked them to measure every 20 minutes. So an hour has 60 minutes, so 3 times an hour. After that, they asked them to wear the mask for an hour and once again take 3 readings, or continue to take reading every 20 minutes. Then they asked them to take the mask off and then once again continue to take reading for 1 hour. Right? So now they have readings an hour before, during the mask, 1 hour off the mask, and then an hour after the mask. So with this, what they did was, sorry, I was looking at a comment. The community was a retirement condominium in Ontario. Number of people were 25. Mean age was 76.5 years. So advanced age. Women were 12, men were 13. So 48% were women, 52% were men. And what they were testing was, this is what is important, they were testing to see if the oxygen level will drop by 2%. So for example, if somebody has 96% oxygen saturation, they were looking to see if they would drop down to 94%. It is said clinically that a drop of oxygen below more than 3% or equal to or more than 3% is clinically significant. It is dangerous. So they actually kept themselves they made it even more tight. And they said, if there is 2% or more drop in oxygen saturation, then they would think that the mask has caused an issue. And the results were the following. What they saw was that they collected two types of data. One, they collected the data which was during 1 hour before the mask, then 1 hour during the mask, 1 hour after the mask. Then they also calculated the data of the difference between the two on both ends. And then they also did the mean pool. What that means is that they would take everybody's data from, let's say, 1 hour before the mask, and then they would take a mean of that. And they would do that the same way for all categories, that with mask, without mask, an hour before, an hour after. And here is the result. Oxygen, mean pool oxygen was 96.1% before the mask. Then it was 96.5% while wearing the mask. And it was 96.3% after removing the mask and measuring in an hour. So with this, what they were able to prove was that the mask itself does not cause hypoxia. Now, once again, in the beginning, when we started having the mask discussions, there were folks who actually sent me messages, and none of their fault. They were trying to protect themselves. And they said that I have made a mask with leather, or I have made a mask with strong material. And of course, if we have a mask which is within non-porous material, then the mask itself can become a hindrance. Plus, it would not filter out a lot, because the air would just move out and in from the leaks in the mask. Ideally, a mask should cover the mouth and nose correctly, and then when you breathe through it, it would become a filter, and it would capture the particles coming in, and it would capture the particles going out. And I have done a discussion about this, that various quality levels, so N95 mask, and then the surgical mask, and then the homemade masks, they have various levels of protection. They're not all equal. And I have done 2 videos about that. So I would connect them here as well. I'll put them here in the description too, but I would request that you look at them as well. So this is a discussion. Let me just quickly go over this PDF. If I could, looks like it is closed. Let me open it once more. Let's see. 1 second, please. Okay, so here is the letter. In this letter, what they did was, I'm just going to repeat this and just show you some more data here. The study protocol was approved by Hamilton Integrated Research Ethics Board. The individual's age was greater than 65. And here is what is interesting. We've seen the rest of the data. This is interesting. Baseline characteristics of the participants. So if you see here, mean age was 76.5, men, women, we've looked at it. Look at the medical conditions. There were people with hypertension, respiratory diseases, bronchitis, interstitial lung disease, asthma, cardiac surgery, diabetes, smoker, medications. They were on statins, ASI, ARB, diuretics, calcium channel blockers, anticoagulants, beta blockers, acetyl salicylic acid, oral hypoglycemic agents, and prednisone. So there was a mixture of folks with these various comorbidities. So in all of them, if you see here, this is the data for some of the participants. And if you see before, 1 hour before wearing the mask, 96.1, 95.8, 96.3, mean was 96.1. Then during the mask, 96.4 one group, another group 96.5, another group 96.7, and then mean was 96.5. And then 1 hour after wearing the mask, 96.4, 96.4, 96.2, and the mean was 96.3. So that is the discussion for today. I want to show you one last thing. I was just sitting after the lecture preparation, and I thought this was an interesting one. Cool beans are a mask nation. So there are some cool beans that are here who are wearing masks. So even if you are someone who do not believe in mask, I think it is useful, it is valuable for your own protection and for the protection of the people around you, that when you are in the community, wear masks. So this is what we have for today. I'm just going to look at some of the questions. We have closed a little earlier today. One request that tomorrow is the presidential election. So if you can give me an off for tomorrow, I want to watch the results as well. And if you feel that we should continue, then I would continue as well. So Janet likes Cool Beans is a mask nation. There was So I have actually created a store on Teespring where I'm putting these designs as well. These merchandise would appear under the videos in another day or two. YouTube is reviewing the store. So there is a Vincent Telfer says hypoxia is caused by debris and fluid buildup in the lungs, correct? Absolutely. So hypoxia can be caused by many, many reasons. In this context, we can say this. For example, if the oxygen is actually low in the environment, then we'll become hypoxic. If the airway is not correctly, if airway has a problem, then we'll become hypoxic. If the lung tissue, as is the case with the COVID-19, has a problem, then we'll have a hypoxia. If the blood itself has a problem, hemoglobin has a problem, or there is some poisoning of the hemoglobin, then we can become hypoxic. If blood vessels are occluded, then we'll become hypoxic. So the reason for becoming hypoxic are many. In this context, yes, the problem is with the lung, where the immune system is reacting so much and causing such a cytokine storm, and the virus is causing damage to the respiratory membranes, that there is local congestion that develops. That congestion, or the immune system's response, will cause fluid buildup. That fluid buildup is going to cause hypoxia. Matt Couch says, I'm sad that this needs, absolutely. And thank you, Matt, that you have a mask on in your picture as well. I thought this was important because as much as I try to avoid debates, many people do push me anyways by sending me messages or comments, and I respect them and I appreciate all comments. I usually do not go in debates. Many people tell me that, hey, mask is actually a bad thing. So I wanted to make sure that whatever little evidence we have, we should share with each other. I cannot ask someone to wear a mask, but at least I can present data. So David, very, very good way to put it. So David, for example, here, David is saying that you are saying that obstructing your breathing passageways does not cut down on your oxygen levels. That does not make any sense. So David, this is what is the important part, that when we are wearing a mask, as I just said, if we actually choke someone, ourselves or somebody else, they would die with that. Masks are made not to choke us, however, be a filter in front of us so that they can trap particles that are coming in and that are going out. Masks are made in a way and they are tested in a way that they do not cause this kind of obstruction where our oxygen levels start dropping. Number one. Number two, I hope you realize that when the gases are going in, when oxygen is going in, we do not consume 100% of the oxygen that goes in. We take in about 100 and we bring in 500 milliliter with one breath. Out of that 500 milliliter, there is 150 milliliter which is already present in the airways, which is already less oxygenated. That would go in first, then the rest of the air would go in, and then we would pick up some part of it. If you actually take the air out, the exhaled air, that would also still have oxygen. You can actually put a breathing bag in front of you and keep breathing in it for some time without actually exhausting the air that is present in that air, in the exhaled air. So it is not that every breath has to bring in 100% oxygen and that oxygen is going to be 100% used. So even when mask offers any resistance, it does not cause enough reduction in oxygen that it causes the oxygen reduction in the body. The body is able to still extract a lot of oxygen and stay healthy. As you can see in this case, even in the advanced age, even with the comorbidities, the oxygenation level stayed the same. There was no effect from mask, and these were 3-layered masks, which was, I think, is quite a serious mask. So I hope that makes sense. So Embals, same here. Had to wear a mask in a shop some days ago. First time I ever wore on. Could not get out of the shop fast enough. Really felt like a great loss of oxygen. Asthma feeling as had as kid. So again, this could be claustrophobia as well, or this could be a condition too. My best way to ask you to check that is to buy an oximeter, and when you wear a mask, see what happens to your oxygen. Claustrophobia and anxiety, and based on that, feeling breathing difficulty is a very natural and physiological process, and it can be seen. So I'm not discounting that, but once you start using it, you can become used to it. Market McKinnon, I've sent shares to state officials, but uncertain if they have reviewed them. I am a Market. I am not very much fan of our administration at this time. I was thinking about it last night. I was lying down and I was thinking, why have we gotten ourselves into this state? And I think one of the reason is that we are behaving at an administration level. We are behaving in the normal routine processes. But the time at this time is exceptional time. We have to behave and operate exceptionally, and not everyone is jumping up and doing that. Our processes, our red tape, our ways of working, our approval processes, everything is more routine like. For example, I went in for my vitamin D test today. So one of the Twitter friends, Cool Bean Avox, had been pushing me since yesterday to say, go get your vitamin D test. So I went in for the Quest Labs. And it was such a weird thing. Number one, they said, without a doctor's document, we cannot do this. And I wanted to test it out, that what would they do to a person who's curious about their vitamin D level. So I said, I don't have any doctor's prescription. They said, okay, go online and apply on pay online, and then we can do it. So I went back to my car, I went online, I paid it online, and then I came back with the order number, and then they said, all right, sit down here. Now the test itself was just blood draw. It was 2 minutes, but I had to wait there for 2 hours. And that I kept thinking that this is the kind of thing that we should have camps everywhere to say, come, let's check your vitamin D levels. Come, let's check your antibody levels. Quest had a notice, plus they had on their phone a recording that we will not do your antibody test until the doctor says. And if the doctor says, please ask them to send the whatever, the order. And I thought that antibody testing is actually very important for all of us to understand. Maybe I'm already infected and recovered, and if I am antibody positive, good. I can be a little less careful with all the situations, and I can probably go do something. And that test is a difficult thing to do. Vitamin D test is a difficult thing to do. So this is all as if we are living in normal time. We are behaving that way, but we are actually in an exceptional time, and it is causing misery and death. And this should have changed. I blame our leaders, administrator leaders, our medical leaders. They have not taken care of it. So Maruri, so there were people in here in the study who were asthmatic as well. Edoc says each 95 mask has a breathability resistance, so some are easier to breathe. The N95 are serious masks. And I salute those doctors who use N95 for their profession and they work with them. So Siddhartha says, I asked the doctor why this was done. When I saw the result in my chart, this was not done. And he said, this is not part of annual checkup. So Siddhartha, that is a problem, that these basic needs, especially at this time, instead of asking the whole world to go do the PCR test, RT-PCR test, why don't you give them vitamin D test? Give them antibody tests. Antibody test would tell them who are still at risk and who have become immune. And give them vitamin D test. That would tell them who is at risk and should go and figure it out how to reduce their risk. And we are just, I'm not a big fan of the current situation. Randy, you are absolutely correct. So if you are wearing the construction mask or any mask which is going to cause a lot of filtration, it is possible that you would have an issue. And they say in this study, one of the limitations, so Randy, very good point. They say one of the limitation is that we did not ask anyone to do strenuous exercise. Their limitation is that this study is small. Their limitation is that they did not ask them to do exercises. They just asked them to do routine work and so on. Margaret, Quest is good, but this is still a normal kind of a process. So, Joe, there are home vitamin D tests. I wanted to go to one professional lab, and I'm now going to do some home tests as well, like Everlywell also have it. So I'm going to test those as well, but I wanted to go at least once to the Quest and see it. Yeah, the mask should not be political. James, this is a very important point, James, that the key concept of the mask is to reduce viral load if we happen to get infected. Dr. Marek discussed the 2 cruise ships, and I had done the cruise ship discussion as well. When we have a mask on, the amount of virus going in reduces, and amount of virus that we are expelling is reduced as well. That improves our chances of defending better with lower viral load. Maybe we would even have very mild symptoms and come out of it because our immune system is exposed to a smaller load, very quickly gets up to speed and takes care of it compared to a larger load. DDS says, I worked on an assembly line for 8 hours with high activity, no problem breathing with a mask. Good. Edoc says, if you wear glasses, spray AntiFog Spray on them, available from optometrist camera shops. Yeah, so glasses are important as well because the virus can actually go and stick with the conjunctiva too. Janet says, confession, ever since I saw Dr. Bean with the blanket over his head, and it seems effective. Thank you, Janet. All right, so this is the discussion for today. Thank you very much. If you are okay, please write a comment. If you're okay for me to take tomorrow off, then I'll take the day off. Otherwise, we'll meet again tomorrow. And thank you very much. Stay safe and healthy. I am very, very grateful to God, to Allah, to lucky stars, to whatever you want to call for this, that our cool beans have not gotten seriously ill. And I don't want to jinx it, touch wood. I am very, very pleased with that. And so please keep yourself relaxed, sleep well, do gargles, do prophylaxis, and have social distance, have mask. We will get through this, but we have to be wise while we are going through this because it is an exceptional time. So thank you very much and see you either tomorrow or day after, depending upon your response in the comments. Bye-bye for now. And please like, subscribe, and share. And if you wanted to support my work, there is a link in the description for donation. Thanks. Bye-bye.